Hello everyone, this is your Pradesh Kothari. I'm pursuing here MPhil in Psychiatric Social Work Department. Now I'm a second year student. So one of my followers asked me to make a video on Psychiatric Social Work course details. So in this video, I'm going to explain very clearly. So what are the qualifications needed for applying MPhil in Psychiatry Department, and what are the course duration? About entrance exam we'll talk, and what are the how much stipend we'll get, and what are the psychiatric social workers roles and responsibilities in the psychiatric hospital, specifically in CIP, how the psychiatric social workers are working, how much exposure they are getting, in which areas they are getting exposures. So I'm going to explain very clearly in this video. If you are new to my YouTube channel, please do subscribe my YouTube channel, and please increase my subscribers. I am having very less subscribers. So let's go, we'll start. So first, if you want to do a course in MPhil psychiatry in any institute, so you must be needed the qualification of the MSW in PG. So other institutes or other universities may ask in the specialization. So in CIP, they're not asking any specialization in your PG. If you are qualified in the Master of Social Work in your PG, so you can eligible to apply for a MPhil course in the Central University of Psychiatry in Ranchi. So then university people are conducting entrance examination, that is a 100 marks examination. 1 hour it will be there. It is a multiple choice will be there. Whoever is scoring the high, and they will be qualified. And based on reservation, they are given every detail sheets. I explained in other video already, so you can search another video. And now, so will come the course duration. So course duration, this is a 2 years course, 2 years course, and a stipend you will be getting 25,000 per month. Every month in the first week or the second week you will get a stipend 25,000, 500 otherwise 405 rupees deducting your hostel fee, like a room and electricity bill and water bill, not more than anything. So 2,450 rupees, around 2,550 rupees you will get for stipend, monthly stipend. Then if we comes our psychiatric social workers roles and responsibility in the CIP. So psychiatric social workers roles is very important in any mental health institute, not only CIP. So they are playing a major role. So like psychiatric social workers will play a major role in handling the patient and family. In the community level, we have to be work. So in the psychiatrist, if you take a psychiatrist who are qualified MBBS and they'll join here PG course, they will only deal with the patient. They will prescribe the medications and they will deal with only individual patients. But as a psychiatric social workers, you have to be deal with the patient and with the family members along with the community. So 3 roles we are having. So in the psychiatric social work department in the CIP, how the psychiatric students are working. If I'm a psychiatric social worker student here, so how I am working. So my work will start with the patient admission, like workup. So OPD every week 2 OPDs we have to be do. So in the workup we have to be diagnose the patient, the psychosocial diagnosis along with the psychiatric diagnosis. So we will take case history and we will take symptoms, and will HOPI will write, everything will be right, and we will diagnose and we will discuss with consultants and otherwise SRs. And if patient is required admission, we will be admitted. Otherwise we will do treatment of OPD based. So what we did here, so case history, case take up. So with admission, with the patient admission to patient discharge, so you have to be work. So if it comes with the patient, then we'll discuss with the patient, with the family members, and with the community level. So with the patient, what we'll do, case workup we'll do with the patient along with the psychosocial assessment, otherwise family assessment we'll do with, and group therapy and a psychoeducation, group meeting, and family with families we will do family therapy. And if patient is having any discharge problem, so if patient is having discharge problem, family members are not taking to him out, and they kept in, they went out, they're not responding, so that case will be referred by the psychiatric social work student. So you have to be called the family members. If the family members are not responding, you have to be called the nearest police station. You have to be take their number, and discharge problem will do. in psychiatric social work department, so in individual case, so we will, if one person is admitted in the CIP, so first we'll do psychosocial assessment or otherwise a family assessment with him. So the family assessment, what are the findings we are getting? If we are have families having critical comments, hostility, and if their family is not aware about the illness, if the patient is multiple time relapsing, so what are the relapse reasons for the relapse, and if the patient is not taking medications, what are the why he is not taking, what is he having any problem to take medication, otherwise getting any side effects of the medication, and if about patient rehabilitation, if he's a patient admitted in a psychiatric hospitals, maybe this is not working, so how he'll manage his medications, cost and everything, and travel allowance and everything. So we have to be plan about the rehabilitation also. So in with the patient, ठीक है. Then if the come with a multidisciplinary team, in the CIP we are following a multidisciplinary team. So we are having a psychiatrist who are qualified MBBS. MBBS, after that need they are here doing a PG, then a psychiatric social worker, then a psychologist, clinical psychologist will be there, and a psychiatric nursing will be there, and along with our occupational therapist, music therapist, and PT and yoga master, and all are this. So we have to be maintain a relationship with all departments. So what are the patient is needed, if he is needed anything, like if he is needed any occupational training, so we have to be refer the patient in the occupational therapy. If he is needed any music therapy, we have to be refer a music therapy. If otherwise if a patient is needed a physiotherapy anything, so we have to be refer with physiotherapy. So referral part also we are dealing here. And if a patient is having so long-term illness and like more than is long-term illness is having, there is no recovery, then we are providing here disability certificate also. So we'll provide disability certificate also. So in the multidisciplinary team with the clinical psychologist, and with the psychiatrist, in the psychiatric nursing, and in other department like occupational therapist, music therapist, artist, and we are having here tailoring also. So with all department you have to be coordinate. In psychiatric patient not require only medication, so he needed other things with the medication definitely helpful for the patient for reducing his symptoms, and after that his occupation level and his functionality in the community level, we have to give him a training for him, occupational training, and else otherwise we have to give him illness awareness, like a psychoeducation we'll do here, psychoeducation, and we have to be engaged with the patient in group meeting and group therapy. So these things are we are dealing with the patient. Now come with the family. With the family, if a family is not aware of the illness, if they are not having information about the illness, they don't know, so then we will start with the psychoeducation with the patient. So I mentioned like we will start in the admission time only, we will start with the psychosocial assessment or family assessment. So in the family assessment, everything will be detailed, will understanding the family about the patient family. So how the time like the family interaction is there, how the subsystems are working, how the family communication is there, how the decision making process is there, how the cohesiveness in the family. So this everything will understand in the family. Based on that, we'll start a management plan. So in management, if the required needed any all patient will do psychoeducation. With that, if needed the family therapy, then we'll start family therapy and a couple therapy. If the patient is needed occupation rehabilitation, so then we will go with the community. So we will talk with the family members in the community where we can be rehabilitating. So if the patient is having any basic skills, so is he interested in any occupation, any particular area, we will be rehabilitating. So then only he will be engaging in the more longer time. With the family, we will do these things. And if the community level, what we will do? In the community level, as a psychiatric social worker, our role is to making awareness people to about mental health. So still the people are having a stigma related mental health. So they'll use like pagal, divana, some particular they word use, and they don't bring directly patient to the psychiatric hospital. They'll take the first, then any like jadutona, faith healers, they'll take first faith healer, then later they will come here. So the making awareness in the community level, So spreading information and sharing information or knowledge about the mental health, about the mental health. So patient and the family members then come early, then they approach early to the psychiatric hospital. So they, if they are approaching early, so we will deal with the patient and the minimal symptoms will be there. They will be, we will handle very easily. If the symptoms is high, the recovery rate is low. So based on for this purpose, the community awareness programs are important. So community awareness programs will deal with the psychiatric social workers. Many programs we are conducted here in Disability Day, in the Mental Health Day. So a lot of programs. Actually now I'm not getting, but a lot of programs we are conducted here. So our director is very supportive, and our department faculties are also very supportive. So now we are having the 3 faculties in our psychiatric social work department. One is a professor and 2 are assistant professors, and 1 is psychiatric social workers also there. So now we completed the patient. I think now you understood the patient and the family members role and the community and how we are dealing with the multidisciplinary team. I hope this video is helpful to you. So now now we will understand the now we will talk about the examination. So that is a 100 marks question here. So 1 hour exam will be there. Whoever scoring the more they will be in the selected list. Then they have to be attend an interview. So after interview they will select the candidates. So we are having a 15 seats, 2 years course. So 25,000 stipend will be get, and exposure in which areas exposure you will get, that also we'll talk. In psychiatric social work department and CIP, Central Institute of Psychiatry, this is a 100 years of old hospital. So previously Britishans are started, and now after independence our Indian government is running this institute. So in this hospital you will get all kind of patients, every kind of patients you will get, every field you will be get the exposure. So this institute is the best institute for the doing a psychiatry field in a psychiatric social work course. If you want to join any psychiatric social work course, this is a CIP Central Institute is the best. A lot of people are having a dream. I also had a dream, so I cleared the examination and I qualified here. So like every 3 months your posting will be changed. So we are having a 24 months, 2 years, 12 months and 12 months. So every 3 months your coach will every 3 months your ward will be changed. So you are having a de-addiction center. We are having a de-addiction center, so you will be get 3 months posting in de-addiction center. And a female ward, so we are having female ward. A female ward you will get a 3 months posting, and child ward, and general wards are other general wards are there. So in general wards remaining posting will be there. And we are having a psychosocial unit, PSU. So this is OPD based, who are coming their assessment and their therapy will be dealing with the psychosocial unit. We are having a separate psychosocial unit in the our hospital. And you will get in child cases, addiction cases, and the psychiatric cases, and the female cases, and geriatric cases. So all cases you are getting here. So you will get a good exposure in psychiatric social work field. After completing your psychiatric social work in a Central Institute of Psychiatry, you are the gem in your field. Definitely, I'm promising you. I'm as a second year student, so whatever we are learning and whatever patients we are getting, that's every kind of patients and all type of diseases. What is mood disorder, neurotic disorder, and psychiatric disorders, and every kind of disorders we will get here. All kind of patients, and lot of things and a lot of work we are having here. So you have to be more patients, and then only will be work. So a lot of work will be there, and lot of things you'll learn here. So major role is a psychiatric social workers. So if family members are not treating well in the well to the patient in their home, the patient will be relapse. So again he will come back. So doctors, they will give only medication. They won't deal with the patient. They won't deal with the family members. They deal with only patient. They will prescribe the medication. They will send to their home. But after the home, how they are treating him, how their like family members' emotions and how the family members' behavior affecting to our patients, their thing, and how the community people are responding him, and community people are having a communication with him and having emotional attachment with him, having a relationship with him. So how the community people are treating him, these all things are dealt with psychiatric social work student. So psychiatric social work student is having more work and important role in the psychiatric field. So definitely, if you are a interested and you are a focused student, you will be do magics with your work. Definitely, you can see that patient's improvement in front of your eyes. We are having cottage also. Who are the needed, the family will be staying in a cottage and I will take therapies here. Otherwise, if they are not available here, they will come follow up. Otherwise, we are having teleconsultancy also. In the online also, we can take therapies. So that's that facilities also we are having in CIP. So CIP is the best for doing MPhil course in the psychiatry field. So definitely choose this is the first option for you, and get it your seat and fulfill your dreams and learn a lot of things and go outside and improve your life. And so I hope this video helpful to you, and if you feel this video is helpful and any useful little bit also, please do and subscribe my YouTube channel and share with your friends, and they'll get news and they'll get update. So thank you. See you soon in the next video. Jai Hind.